Around 10 to 14% of Europeans have an overwhelming fear of dentists. These patients suffer from a phobia against dental treatment, which is actually a psychological disorder, making a visit to the dentist almost impossible. This young man is one of around 5 million such patients in Germany. After a traumatic experience in his childhood, he was too afraid to undergo any dental treatment for years. When he thinks about visiting the dentist, he's overcome by panic attacks, palpitations and sweating. 1/3 of these patients is even at risk of suicide. Today he has a large number of diseased and unhealthy teeth, which hardly allow him to eat a normal meal. He can only avoid toothache by eating soft food. The pleasures and enjoyment of eating are a thing of the past. His wife also misses the outings, visits to restaurants, and meetings with friends. Contact with other people became more and more infrequent as a result of the toothache, embarrassment when talking in front of other people, and fear of ridicule. This patient had almost completely withdrawn from active social life and became isolated at home, alone with his fear. As Mr. L did not want to undergo any lengthy and complicated treatment, he contacted the Gentle Dental Office Group. This medical team is made up of unusual dentists, who not only take a close look at the teeth of their patients, but also investigate their feelings. Their work is accompanied by psychologists who are specialists in the treatment of phobias, and also anaesthetists who work in accordance with the latest scientific findings. At the first appointment, the patient meets the team and gets to know them. Dr. Loy explains exactly how he'll be treating them, and then x-rays their teeth. The patient does not have to fear any accusations, invasive questioning, or uncomprehending looks. Dr. Loy listens carefully and takes all their fears seriously. Treatment itself starts at the second appointment, under a full anesthetic. While the patient is under the anesthetic, all the teeth are treated. Fillings are replaced, root canal treatments performed, and teeth extracted. Any resulting gaps are filled with temporary restorations, and the patient immediately sees a cosmetic improvement. Dr. Loy emphasizes that this aspect is extremely important to give the patient a new sense of confidence and self-assurance, and to enable them to undergo dental treatment in the future without fear. Our patient from Germany is able to admire his new teeth immediately after the operation, and we can see how happy he is with the results. Another appointment is scheduled for 2 weeks later, and the temporary restorations are removed to make way for the final versions, this time without any qualms at all. This patient is thrilled to see a perfect set of teeth when he looks in the mirror. We can help you too to get your smile back.